Today on Forbes, your medical privacy could be at risk, a new lawsuit shows. Imagine you've confided in your doctor about a sensitive medical issue. You haven't even disclosed the condition to your family. Then, a week later, you get a call from a lawyer who asks to chat about it. Epic Systems, the nation's largest electronic health records company, has filed a lawsuit claiming that, quote, bad actors have been marauding as medical facilities to steal and misuse at least 295,000 patient records. Epic alleges these companies inappropriately monetize the data, such as by selling it to lawyers seeking class action participants. Epic, which was founded by billionaire CEO Judy Faulkner, does not yet have proof that stolen data was ultimately used to build legal cases. But the lawsuit presents evidence to claim the defendants have been trying. One defendant said her firm can, quote, request and receive all of your clients' medical records in less than 48 hours. Another advertises, quote, same-day medical records retrieval to law firms. A third says it, quote, pulls records straight from providers' EHRS and sends them to representative firms. EHRS stands for Electronic Health Records. The speed at which they offer these services is a red flag indicating they're falsely claiming treatment purposes, Epic alleges. The company allegedly enabling these actors is Health Gorilla, a healthcare technology firm that acts as a gatekeeper through which patient records are exchanged. Epic claims Health Gorilla, quote, knowingly participated in and enabled the abuse. Reed Health, Trinity Health, and UMass Memorial Health are co-plaintiffs. The digital exchange of patient data is known as interoperability and is largely beneficial to healthcare, according to Metroport CEO Dima Goncharov. He asserts that this technology is, quote, definitely a net positive in the US as it eliminates the need for patients to transport physical binders of medical records between providers. But that transformation has also led to complex data sharing systems where the abuse described in Epic's lawsuit is possible. Instead of just medical providers requesting data, others can ask for it too. Carequality is a 2014 nationwide nonprofit network used by about 70% of U.S. hospitals that handles over 1.2 billion records monthly. The lawsuit alleges all fraud against Epic occurred through Carequality. With fewer than 10 staff, Carequality doesn't vet requests itself, but rather outsources the task, using intermediaries like Health Gorilla to onboard users and to verify the legitimacy of treatment-based record requests. But the incentives are complicated. Denying access means losing customers, and Carequality is not legally obligated to check the gatekeepers' work. A Carequality member who asked for anonymity said, quote, everybody whispers about it, and I wasn't surprised to see this lawsuit. Carequality said it is, quote, committed to protecting sensitive patient information. The company also noted that gatekeepers are responsible for oversight. Given Carequality's scope, the number of documents impacted could be much greater than the nearly 300,000 Epic identified. Epic could only track records from its own customers, excluding large systems such as the Department of Veterans Affairs. Sometimes non-treatment uses are legitimate, such as insurers verifying care. But when marketers or lawyers request data, that is generally against the rules. Because Carequality does not give them a way to see who has access to their records, most patients affected by the behavior alleged in Epic's complaint are likely unaware their data was ever taken. This is not the first time Epic has raised such allegations. In 2024, Particle Health sued Epic, accusing it of monopolistic behavior. Epic responded by accusing Particle of allowing improper access to records. That legal battle is ongoing. Epic has long faced scrutiny for its dominance in the industry. The private company is used by roughly 42% of U.S. hospitals and reported $5.7 billion in revenue in 2024. Health Gorilla's response to the lawsuit draws on those criticisms, calling Epic's actions, quote, exclusionary. Meanwhile, the Epic Particle dispute has already influenced new federal data sharing rules designed to make it harder for non-medical providers to obtain records. If Epic succeeds, this lawsuit could also push reforms either within Carequality or through the Trusted Exchange Framework and Common Agreement, or TEFCA, a newer government-backed system. For full coverage, check out Monica Hunter Hart's piece on Forbes.com. This is John Palmer from Forbes. Thanks for tuning in.